Asking Searchable Questions, presented by Moody Medical Library, Reference and Educational Services. Types of questions. In evidence-based practice, questions can be divided into two types, background and foreground. Background questions ask for general knowledge about a topic: who, what, when, where, why, and how. Basically your journalism questions. Example: what is otitis media? Where is the tympanic membrane? How do you treat swimmer's ear? Foreground questions ask for specific knowledge for patient care. They use the PICO format: patient or problem, intervention, comparison if relevant, and outcome. Example: in young children, is Augmentin or Omnicef better for treating otitis media? You need a grounding in background information in order to work with the issues in a foreground question. If you do not know what otitis media is, you'll have a hard time understanding the issues surrounding treatment options. Bottom line, you need an understanding of your own knowledge gaps in order to know where to look for answers and recognize the answers when you find it. In other words, where is the edge of your ignorance? What do you really need to know? Turning a question into a search. Searching for evidence or for information to take care of patients is different than searching the web. Google, Ask Jeeves, Wikipedia, etc. These resources have their place and can be very useful for some questions, but they're not well designed for finding scholarly information, at least not yet. Most professional literature databases work best by searching concepts rather than complete sentences. In our example, in young children, is Augmentin or Omnicef better for treating otitis media? The concepts to search would be Augmentin, Omnicef, otitis media, and since age is best handled by limits, young children will be handled with limits. But what is a young child? What does that mean? That is something you would have to define in order to continue with your search. Not every word in your sentence will need to turn into a search term. Some concepts are contained in a search term and do not need to be specified. For example, prostate cancer affects only males, so male would not need to be searched. Other concepts are best read for in the results. Words like effective, helpful, better, worse, greater, less, before, after, first, last, etc. The same patient encounter or scenario can lead to multiple questions. In real life, you will frequently know more information about a patient or topic than is required to perform a search. Decide what is your question. Don't worry about details that don't fit into your question for creating the search. Use these extra details in helping you identify relevant articles in the result. Let's use this clinical scenario as an example. You are at the clinic and see Mrs. Smith. Mrs. Smith is 35 years old, 5'4", and weighs 170 pounds. She has 3 small children and is employed as a computer programmer. She describes her stress level as moderate to high, depending on work projects and the children's schedules. She says her husband is supportive. She has come to the clinic to get her cholesterol checked and get her hypertension medicine refilled. You begin to provide counseling on diet and exercise for weight loss. She mentions that she's heard on the news that wine and liquor is good for heart disease. You decide to search the literature to see if any evidence or maybe research studies is available to support this claim. This one scenario could lead to questions such as, in adults, is low-fat diet effective for weight loss? In adults, does weight loss help reduce hypertension? In adults, does hypertension lead to high cholesterol? In adults, does a high-stress lifestyle contribute to hypertension or high cholesterol? Based on the patient's question, our question is, in adults, is wine or alcohol consumption effective for preventing heart disease? Concepts to search: wine, alcohol consumption, and heart disease prevention. Note, it's not necessary to specify adults, since there should not be many or any articles on children drinking to prevent heart disease. In conclusion, spending time constructing good questions can help searching be a more successful experience. Librarians are available if you need help turning your question into a search. Other tutorials on finding answers and search tips are also available. Questions? Ask a librarian. Chat or email from the library's homepage, or call 409-772-2714. 2372 or come by the reference desk Monday through Friday, 8 a.m. to 5 p.m. Thank you.